Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, a plastic surgeon is suspended for allegedly operating while drunk. It's a crazy story. And then we got an update to the Bradley Cooper plastic surgery rumors. And then finally, was 2025 the year that admitting to plastic surgery became cool? We're going to talk about it, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. It helps us so much. I'm your host, plastic surgeon Dr. Bruce Hermann, and I am very sad to announce that, unfortunately, Sarah Bennett, my co-host for over 3 years, is no longer going to be on the show. We're both very sad about it. It wasn't something that either one of us wanted. She just simply got a new position in her regular day job, and unfortunately, she cannot get away to do the show anymore. And so it was kind of quick, kind of sudden. I'm really kind of bummed that I didn't even know our last episode together was going to be our last episode, but yeah, I can't say enough great things about Sarah. Definitely am going to miss her. She was just always here for the show, and yeah, really bummed about it. But I do still have Brenna. Brenna, are you there?
Yes.
Oh, there you are.
Hi.
I lost you in the microphone for a minute. You're back. Yeah, so no more Sarah, Brenna. You're gonna have to carry me through this. You're gonna have to carry me through this episode.
Big shoes to try to fill for the show.
So, well. Speaking on that, I do have a potential new co-host. I'm not going to say who it is just yet. I want to make sure it's all final. I'm super excited. This is a person that is in the media, or has been in the media. So I think it's going to work out, but I don't want to announce it just yet. I'm hoping maybe next week will be our first episode, if not the next week. But definitely stay tuned because we're about to just move on to the next phase of the Nip Talk. The Nip Talk. What do we call this? Journey? The journey of Nip Talk.
Yeah.
Yeah. All right. Did you have a good Christmas? I haven't seen you in like 3 weeks. You doing okay, Brenna?
It's been like almost
I know
a
it's been
month.
forever. Well, and we haven't done show in 3 weeks because there was the 1 week that Sarah told me she had to leave, and I just like, okay, we'll just take a step back. But then it was like Christmas, and then New Year's, and the studio was closed.
Yeah.
So
It's been a while.
we really only missed, I guess, one episode that we could have done.
Yeah, but it's like I was looking at the date. It was almost exactly a month. So
Yeah.
it's been a while.
It has been a hot minute.
Yeah.
That does mean that there was a lot of things to talk about when I was looking at segments. But there's always stuff to talk about. It's I always, sometimes I'll be like, geez, how am I going to keep the show going? And then I look, and every single week there's just like so much to talk about. So, all right, you ready? You got to help me.
I know.
I'm
ready.
This is your day, man.
I'm ready to jump right back in. But yeah.
Okay, all right. Well, the first segment we have is one that's actually really sad and also a bit dangerous. So this is a segment about a plastic surgeon who had his license recently suspended for allegedly, this has not been finalized, but allegedly operating while drunk. And of course, when I saw this, I was like, well, it must be in Florida, but it's not. It's here in Texas. And can't believe
no.
it. I know, right?
Oh my gosh.
Usually my Texas peeps are like solid, but so this is out of Houston, Texas.
Okay, I was gonna ask what part of Texas.
It was in Houston,
Okay.
yeah, Houston. I don't know this guy, and so the other thing too, I wondered, Brennan, was like, they say plastic surgeon, but was it some cosmetic, dentist doing plastic surgery? And this guy was like, he is a legitimate plastic surgeon, like the real deal. So it's Dr. Azul Jaffer out of Houston, Texas. And just this past week, the Texas Medical Board came out and suspended his license. And actually have that. I just want to make sure we're all legit here. I want to show this is not just hearsay. Show that one picture. Yeah, this is from the Texas Medical Board, and I'll summarize it. His continuation of practice of medicine poses a threat to public welfare. Ow, that hurts. Due to habitually using drugs and liquor. Man, that's kind of brutal. I saw that. I was like, okay. I thought,
Yeah, and hopefully not together. It's a bad combo.
yeah, that would be a super bad combo.
Yeah.
Well, and I wondered when I first saw this, I was like, okay, there's two things that this could be, right? Because, I've been in medicine now 23 years. God, I've been an MD for 24 years. God, it's hard to believe, but 24
Almost
years.
Since as old as I am.
I know. Yeah, I knew you were going to say that. And
I was born in 2002.
Now I'm going to go jump out this window, Bennett, so thank you. But yeah, so I've been in the biz a long time. And so I've known people over the years who ran into trouble with, drugs, alcohol, physicians. And so usually it's one of two things. There's the one scenario where somebody goes out to dinner, has a couple glasses of wine, they get nobody gets paged anymore, but they get a call. And instead of saying, hey, I can't come in, they go in and someone realizes they've been drinking and they get hit. And I know people that's happened to. But then there's the other kind of group of people where they actually have like a serious problem. And I guess you could say that, both are a serious problem, but I meant more like they have like an addiction issue. And so I was really wondering which way this was going to go. And when I started looking into it, it definitely seems like it was more the latter of like, this is like a serious problem. So the Texas Medical Board alleges that there were numerous incidents that occurred over the summer of 2025. And these
that's recent.
Yeah, this just happened. This is all like brand new. Of course, if it turns out that these things are true, who knows how long it really has been going on. I mean, as they say, like the first time you catch somebody doing something is not always the first time they did it right. But the incident included surgeries where Dr. Jaffer allegedly appeared intoxicated while operating, or was allegedly intoxicated prior to surgery, and the facility canceled his cases out of patient welfare. And it wasn't just one time. There was allegedly 7 incidents. At some points, they said he was stumbling, had the smell of alcohol on his breath, and at one point, they followed him into, I guess, the restroom, and there was like a bottle of liquor that was like in the trash or something. I mean,
that's crazy.
Yeah, this all sounds pretty not good.
Or like being the patient and you can like smell it on them.
Yeah, that would.
You're familiar with it.
And I wonder.
It's so scary.
Like I always kind of assumed that if somebody came into like the surgery facility intoxicated and they had to cancel that case, that like everything would stop at that point.
Right.
But allegedly this has happened multiple times.
Wow.
Even more crazy, Dr. Jaffer was indicted in December on a felony charge of performing surgery while intoxicated. And that was one of those instances of the, I guess, 7 that the Texas Medical Board was talking about. So obviously this is a really bad thing. I feel bad for the guy, Dr. Jaffer. I feel bad, obviously, for his patients who, potentially were put in harm's way if all this turns out to be true. I mean, obviously, something is really, I think, kind of wrong in his life if these allegations are true. I mean, I get, being a doctor is a stressful job, and a lot of people like to go home and have a glass of wine or whatever. But I mean, the overwhelming majority of physicians can separate that from their work. And if you're drinking during the day and like knowingly drinking and going on the job, like that is just like a whole another set of issues.
Definitely.
And so, I mean, this guy's got like a long road ahead of him because he's got this it's like a state indictment for felony, I guess it's endangerment of patient. I don't know what the actual felony is. I mean, I think there actually is a felony specific to operating while intoxicated, which is kind of odd that there's an actual law for that.
Yeah,
I mean,
I never would have thought that would ever.
Like you normally,
be a thing,
you would.
It makes sense.
You would think that it would be like a law of like, okay, don't endanger a patient, and it falls under that. But apparently, there is a felony in the state of Texas for operating while intoxicated. So he's going to have to deal with that,
That's bizarre.
Yeah, it's crazy bizarre. And the other thing that's going to happen for sure is you're going to start to see patients coming out of the woodwork. Because, I mean, I looked this guy up and he has like good reviews. I mean, he's not like a sketchy dude. I mean, at least on the face. And so what's going to happen is people will start to patients are going to come out of the woodwork and say, oh, well, I had a bad outcome because of this and that and the other, because of these new allegations. And, it's very possible he could, permanently lose his medical license in the state of Texas. I mean, I guess it just depends how deep the rabbit hole goes. And so I thought I would just take a hot minute and talk about, the issue of impaired physicians. I know we've done segments on this in the past, but I'm not sure if you.
Yeah, I don't think so.
Yeah, I think we did them.
New to me.
Yeah, we think we did them, earlier before you came on and joined us. And so, I can tell you firsthand that being a surgeon is a stressful job. And I would say of all surgical specialties, I feel like mine is not as stressful, or it's at least different. It's more business stressful than patients dying, and things that other surgeons have to deal with. But there definitely is a higher incidence of specifically alcohol abuse with surgeons. And there's a very, very well-known, it was actually a survey that was done, and it was a really big survey, and it basically looked at certain criteria markers for who might have a issue with alcohol. And if you look at the general population at any given one time, there's somewhere between 6 and 11% of the population that meets criteria for, abuse or dependence on alcohol. Well, when you look at surgeons, the numbers are actually much higher. And these are snapshot numbers, which means that the cumulative risk over someone's career might be higher. And that makes sense because, every person in America at times has, troubles in their life or harder things. They may be divorce or the death of a loved one or loss of a job or whatever. And sometimes that makes people turn to other things like alcohol. But again, general population, 6 to 11% for alcohol abuse. For surgeons, this is crazy. And this is pretty wild because they separate it into male and female. Male is 14%. So that's definitely higher than the average. Female was 25%, which is it's almost unbelievable.
Yeah, that's crazy.
That's crazy high. And again, this is like a snapshot, so it's not, a study that was done over 20 years or anything. But based on the study, it's around 16% overall for surgeons, which is dramatically higher than the general public.
It makes sense. It's a stressful job.
It's a stressful job, right?
Yeah.
I get it. And there's no excuse for it. And I think that, I definitely think that it's
a pattern.
There is a pattern there. But I think that there's definitely should be some differentiation between, the surgeon that goes home and drinks and maybe he's, drinking more than he should for his health, but he's not letting it bleed over into his work where, he or she is going into work drunk. That is just obviously a huge, enormous problem.
What if they have like a 5 a.m. shift?
That's a great question, right?
Started early then.
Yeah, that's a great question. Yeah, because let's see, what is it? I think I can remember this. I think that your blood alcohol content drops every hour by, what is it, 0.02 or 0.03?
I think that
Do you know?
sounds about right. I don't know exactly, but.
Yeah, I guess you have to think about that. If you start super early, you can't be drinking until 1 a.m. And we've actually had some segments where we talked about that. There was the one where and I don't remember the specifics because we talk about so many of these crazy stories, but there was the story of the girl who died and she was out partying with her plastic surgeon until 1 a.m. or something. And I was like, man, that's not good.
Yeah.
You can't go drinking late at night when you got to get up at 5 a.m.
At a Botox party or something too.
What?
What if it was at a Botox party?
No, I think they were out partying. They were at the nightclub hanging out.
I feel like that could be a thing that could happen at a Botox party.
Oh,
too.
what, people drinking? Yeah.
Yeah.
Well, because a lot of the Botox parties, hopefully the injector's not drinking, but but a lot of the people getting the Botox
Definitely.
are, which then brings up other problems. Botox parties are a little sketchy because of that, because they very commonly do have alcohol and can someone really consent if they're under the influence? The law says no, but people do that stuff all the time. I admit, I did Botox parties when I was fresh attending because, you're trying to drum up business and pretty quickly I dumped those. I just didn't like carting the Botox around and it's a lot of waiting and yeah, I quickly got out of that. But yeah, this is a really, really sad story. Again, I feel bad for him that he's at a point in his life where it came to this, and definitely feel bad for his patients. At least right now, there's no one claiming that they were injured because of this, but I bet it's coming. And it may or may not be true because anytime bad news comes out about doctors like this, then people start filing lawsuits. because it's an easy way to win, right? I mean, it's like any bad problem that happens to you, it's like, well, it's because the guy was drunk, obviously, and that's a very, very powerful plaintiff statement if it goes to court.
Yeah,
So.
definitely.
All right, well, Brent, let me recap this story real quick. So, man, this is a wild, wild story. A plastic surgeon, an actual plastic surgeon out of Houston, Texas, just had his license suspended by the Texas Medical Board, a Dr. Jaffer, Azul Jaffer, and he allegedly, this is alleged, nothing is confirmed, was operating while intoxicated. And I thought, well, maybe this was a one-off where the guy was having some drinks with dinner and went into work when he shouldn't have. But allegedly, this is something that had multiple times. And in fact, he was indicted just last month on felony operating while intoxicated, which I didn't actually know that was a named felony, and apparently it is. So this guy's license is suspended until all this is sorted out. As I said in the segment, I just feel bad both for his patients that potentially were put in harm's way if this was true, and also for him that he's at a point in his life where he just made a series of really, really bad decisions. So we'll definitely follow this one to see what happens. So, all right, Brenna, you ready to talk about some celebrities?
Yes, I am.
All right, this is one of my favorite celebrities. This is my bro crush that we're going to talk about. So, do you like Bradley Cooper? He's a little, obviously, we're a little bit apart in age. You've seen his movies, right, Bradley Cooper? Okay, all right. Well, sometimes like these actors, I guess he's been in a lot of movies lately. Mm-hmm. So, all right, well, we are doing an update from a segment we did a couple months ago about one of my favorite actors and my admittedly bro crush. This is a Bradley Cooper plastic surgery update. We got some new information here, and I'm going to tell you, Brenna, I'm going to spoil it a little bit. Like, we were pretty accurate. I'm just going to let you know that.
Perfect.
Have you watched you didn't watch the videos that I uploaded, did you?
I don't think so.
Okay.
No.
All right, good. All right, well, I want you to be surprised.
Spoilers?
Yeah, they are spoilers.
Okay.
I want you to be surprised. Okay. So I'm going to just recap real briefly for the people who didn't see our last segment. You should check it out, though, because it's a really, really good one, and we were on point. So Bradley Cooper, approximately 2 months ago, went to a Vogue party with his girlfriend, Gigi. Is it Hadid or Haddad? Is it Hadid?
I think it's Hadid.
Okay, Hadid.
Yes.
All right, sorry, Gigi, I got your name wrong. So went to a Vogue party, and his fans were shocked at how different he looked. And we actually did a full segment on that. And of course, when he looked so different, the plastic surgery rumor mill started, as it always does. And there were even plastic surgeons out there, these, social media plastic surgeons, which I guess maybe I'm one at this point, I don't know. But they were like convinced that he'd had a bunch of surgery. So I was like, all right, we're going to be the judge. We're going to see, has he had a facelift? He's had his eyelids done, all of these things. And, just cutting to the chase, I disagree. I did not think he had surgery. In fact, I think Brenna, you and Sarah both, after we looked at this stuff, agreed. We don't think he had plastic surgery. So I got a video from our last episode. I want to show it because it's going to be important. So roll that first video. So I pulled some pics. All right, show that next pic, Brenna, if you would. Okay, this is the same photo shoot. All right. So let's start at the bottom. So if you look at the bottom arrow, it's pointing to that little kind of curve along his jawline. And I'm not picking apart Bradley Cooper here. The guy's a good-looking dude. I already say he's my bro crush. So Bradley, if you're watching this, I love you, man. All right, so you see, though, that he's got, some jowling right there, okay? Yeah. That's what you would expect for somebody that's 50 years old. And so right off the bat, I'm like, okay, well, if he got a facelift, he got a terrible facelift because they didn't even fix the one problem that you would want to fix. Now, I know this picture probably doesn't look super crystal clear to us in the studio, but if you look at that second arrow where it says hair normal, I'm looking at his sideburn, and I'm looking at that clear space between his sideburn and the anterior or the front part of his ear. Mm-hmm. There hasn't been skin taken up there. Right. So he did not have a facelift. I can tell you that. Looking for the eyelid, because he's always had a blepharoplasty or eyelid job. He's got eye wrinkles. I can see them even on this crappy monitor. So, again, it doesn't look like he's had his eyelids done. So, this one picture here to me is basically proof that he hasn't had a facelift, he hasn't had a neck lift. I don't think he has eyelids done either, because if he did, they'd look different than they look now. So, looking at that, I think I can safely say I agree with the people in the camp of he has not had recent surgery. Okay. So, there was that where I made the case that Bradley Cooper had not had plastic surgery based on the pictures that everybody was looking at that say he did have plastic surgery. And then after that, we kind of discussed, okay, well, what's different about him? Because we did agree he looked different, and we threw up a picture. I probably should have included it in this episode, but I didn't. But I think it'll be in the next video. We all agreed he looked different, and we were trying to figure out why he looked different, and we discussed that. So throw that one up there, Brenner, the next video. Please. But I want you to look at this picture from a month ago, and I want to compare it to the next picture. Brenner, throw up the next one. Okay. Here, to me, he looks totally different. So the white arrow, the top arrow, I'm looking at the area in front of his ear and under his cheekbone. To me, it looks hollowed out, like he looks thinner. And
yeah, he does look like he lost weight.
And then the black arrows, look how thin his neck is. Go back to the one where it's the side by side. It was like the second picture, Brenna. Yeah, look at the difference in his neck.
Yeah.
Like his neck is way thinner.
That's what I was looking at too. He definitely looks thinner.
He's lost weight. And then if you look at his body, go to the final picture, Brenna, the one where it's like the full length one where it's him and her. Well, it's kind of hard to tell in that picture. But when I blew that up, he looks like super thin.
Yeah, I bet it's for a movie or something, you think?
That's a great question. In fact, that's exactly what my wife asked because she came in.
That is a good point. It could be for a movie.
It could be. I was wondering, and my wife asked me that too. I was like, geez, I don't know what Bradley's up to. I haven't talked to him in a while.
Because think of like Christian Bale.
Yeah.
Like how he looked in Batman, and then he like did some other movie where he was like addicted to some kind of drug.
So I think that the reason that he looks so different is because he's lost weight. I don't know if he's been sick. I don't know if he's on the Ozempic. Maybe
the Ozempic?
Maybe the Ozempic is going around.
Got that Ozempic.
Maybe he is doing it for a role, but I think the combination of the weight loss, which hollowed out his face, the hairstyle change, and the beard makes him look like almost like a different person. And so I think that's your answer. I mean, all this talk about surgery is just, nonsense. I can't believe that one plastic surgeon was convinced he had surgery. I mean,
yeah.
Okay, all right. So we kind of came to the conclusion, Brenna, that he was getting all these plastic surgery rumors because he looked so different. And we said, he's lost weight, his hairstyle is different, maybe he's changed his appearance for a role. Well, Bradley Cooper was recently on the Smartless podcast. Have you heard of that one, Brenna? Smartless?
I haven't.
I haven't either. And
I don't really know too many podcasts because
you're not a podcast person?
I'm a podcast producer, so you'd think I'd listen to them more, but I don't really listen to
them. Dude, I'm the same way, Brenna. I've been doing a podcast for 3 years, and the only podcast I listen to is my own.
Like, I technically listen to them during,
while you're producing them?
Yeah.
Right. Okay, I hadn't heard of the Smartless podcast either, but apparently it's a pretty good one. So they got Bradley Cooper on. I'm still working to get Bradley here. So far, no luck, Brenna, but I'm going to keep my fingers crossed.
A little bit of new heights whenever I see something interesting that Travis is talking about, or if Taylor is brought up.
You're right.
Anyway.
So when he was on the Smartless podcast, the plastic surgery rumors came up, and he had some of his closest friends there, and I can't remember exactly who they were, but they were like, oh my God, everyone knows that Bradley Cooper has not had any plastic surgery, and he's there like nodding and saying, yes, he was agreeing with them. And then more importantly, he spoke about what he was currently doing, and he is doing a role, for someone who I'd never heard of, a comedian, John Bishop. And what do you think John Bishop looks like, Brenda?
I don't know.
It's not a trick question. He looks like Bradley Cooper looks like now. So throw up the picture of John Bishop. And I don't have like the full length photo. Yeah. Look at the hairstyle. It's the same. He's like thinner in the face. He's a thinner dude. Bradley Cooper.
I was going to say like youthful or something.
Yeah. Well, and I'm sure he's probably playing John Bishop when he was like a little bit younger as well. So that would 100% explain why his hair looks different, maybe why he's thinned out. And really, honestly, I'm super proud of us because basically everything that we had, discussed and were just speculating on, it seems to be true. He basically denied he hasn't had any plastic surgery. I mean, I guess it's possible that, some people were saying, oh, well, he didn't specifically say no plastic surgery, but he did agree when his friends over there said he's never had plastic surgery. So to me, that's him saying, I've never had plastic surgery. Yeah, that's confirmation, right? Thank you, Brenna. Thank you.
Pat on the back for us.
Right, we get a gold star.
Yes.
And then, he said, I'm doing a new role, and it's this guy, and then you look him up, and he looks like a thin, wavy-haired dude that's kind of thin in the face as well, and everything falls into place.
I dig the look. I think it's a good look for him.
Really?
Yeah.
I don't know. I think he looked better before.
What's
different strokes
your
for different-
perfect version of him? What's your
I've always
ideal
liked
man crush
him-
version of him?
I always liked
What
him in the
era?
first Hangover.
Oh, okay.
Yeah. Do you remember do you remember the movie Wedding Crashers? Remember he was in Wedding?
Oh, yes.
He was like the real mean dude that was like the fiance of one of my favorite actors, Rachel Adams. I love her. Yeah. No, I just think he always looks good. His hair's good. He's got
He's just a good-looking dude.
He's just a good-looking dude, right? I don't always run around saying dudes look good, but he does look good. So, but yeah, I think that this update was worth doing. One, because it's like, hey, oh my God, we were right. We're so smart. But also too, it kind of confirms, and also too, people should stop and think before they say, oh, so-and-so's had surgery. I mean, again, I may have to look up that one plastic surgeon. It was like, oh, you can see he's had like a facelift here and a neck lift here. And I was like, what?
Fact check.
What? I think it was somebody outside the United States, which that probably shouldn't matter, but I don't know. Sometimes plastic surgeons outside the United States like, oh, this person had surgery. Like, okay, yeah, sure. All right, very good. So, all right, we were smart, Brenna. Write that down. Can you write that down for me? That
I will.
We were
Pat yourself on the back.
All of us. We all did good.
Yep.
It was a team effort. I'm sorry Sarah's not here to share in the
Shout
victory.
out, Sarah.
Okay. All right. Let me recap this one. Bradley Cooper, my bro crush, was back in the news because he is squashing those plastic surgery rumors. We talked about this a couple months ago. You should definitely check out that episode because we were all absolutely right. We were looking at photos of him when the rumor mill started that he had plastic surgery. We were like, I don't think Bradley has had plastic surgery. We said that. I showed the girls, they all agreed, and guess what? He was just on the Smartless podcast and he smashed those plastic surgery rumors, and then, just like we had speculated, said that he is doing a new role for John Bishop, this comedian. And guess what John Bishop looks like? He looks exactly like Bradley Cooper looks like right now, which explains everything. So I knew Bradley didn't have plastic surgery, not that that's wrong, but I just hate when the rumor mill starts for no reason, and it looks like that Nip Talk had it right. So smart us, right, Brenna?
Yep, smart cookies.
We are smart. We have to get excited when we're right. It doesn't happen all the time,
no,
so we nailed that one.
Yeah.
Okay, all right, on to the final segment. Brenna, let me ask you this question, because you're, a little bit younger than me, and what do you think? Do you think when someone says that they have had plastic surgery, do people look down on them? Do they not care, or do they think, oh yeah, that was great? As a young person, what do you think?
Oh, I think it depends.
You think it does depend?
Like my age group, I feel like it's not really down. Like I don't think it's a bad thing. I feel like older generations would be like, oh, like why would they do that? I don't know.
Okay.
Like I feel like
that makes sense because what I would say is historically, people would look down on other people that had plastic surgery, right? Mm-hmm. And I think there's been a pretty big shift, and it's happened fairly recently. I think it's been kind of gradual, but definitely with the rise of social media. But I saw a really interesting article that came out of Vogue, and it asks, was 2025 the year that admitting you had plastic surgery became cool? And you know what? I think that this article was pretty accurate. I think it's not just 2025, where in 2024, if you had said you had plastic surgery, everyone thought you were the devil, and then suddenly in 25, it was good again. But man, I really will agree that in 2025, we had a lot of celebrities coming out and sharing their plastic surgery journeys, which is kind of new. Like in the past, like celebrities that you obviously knew had plastic surgery would take it to their grave, like, oh no.
Yeah, it's like way more normalized.
It's been way more normalized, and social media definitely has played a big part in that. Mm-hmm. So, and I think also too, and this kind of concerns us. I think the rise of podcasts has also made people more open. I definitely think social media is the biggest driver, but also, you get, when these celebrities get in these very informal type sessions where it's a podcast and it looks like you're just hanging out in someone's living room, I kind of think they open up more. I don't know. Do you think that? I know we
Yeah.
just discussed that neither one of us watch a lot of
I know.
I watch podcasts when I'm getting information for segments,
Yeah.
but it's not like I have like a list of podcasts I watch.
Have you heard of Call Her Daddy?
Yes, we did
Yeah,
it
I like that. Immediately thought of that one.
because
They're so,
of
She has all the celebrities.
who is that
numbers.
girl that was like the Megan Fox?
Yes.
Was it Megan Fox who was on Call Her Daddy and she was talking about her plastic surgery?
I didn't watch that. I saw I know Kim Kardashian was on
Oh,
it
was
too.
she?
I
We-
didn't see the Megan Fox
We did a
one.
whole segment on a celebrity plastic surgery that it was the same exact thing. She was on Call Her Daddy and she would just like, blah, this is what I've had done. And it was all like new. And so I definitely think that podcasts have contributed to a lot of these celebrities opening up, which then
Yeah.
what happens? Then the average people starts opening up because if celebrities are talking about their plastic surgery, it's suddenly less taboo. And then you get like the suburban house moms that are talking about their plastic surgery journey on a TikTok series. I see that stuff all the time. I've even had some of my patients do it, which is totally fine with me because it's just free advertising. And so I definitely think that there's been a lot more people in the past years, but I do agree that 2025 was almost kind of like a tipping point where, you know, suddenly everyone was talking about, I've had this done, or I'm thinking about having this done. And it's really been kind of a change. And so if you look at the data does agree. Content about specific procedures such as facelift, eyelid surgery, rhinoplasty, certain breast surgeries all saw a dramatic increase in searches and
I feel
posts.
like lip flips or lip injections
flips,
too.
yeah.
Like that's
Lip injections.
Even like people I know. Like I know
Yeah.
so many people that have done it.
Well, you're an expert now, Brenna. And so when your friends start talking about doing their lips, I want you to say this. Are you ready?
Yes.
Okay. It's okay to do your lips, but please, for the love of God, don't do too much. Because there is a super fine line between I'm getting lip filler and my lips are looking better and better and better, and then whoosh,
Yeah.
suddenly you look like Madonna in her alien phase.
I gotta show you some off screen, and I
Okay.
gotta get your opinion.
Okay, definitely. Yeah, I want to see him.
Okay.
Definitely. So oddly, looking at like what's been hot lately on social media, Botox posts are down. Some of the filler posts are down as well. And I think this may go to what we've talked about in the past, that the overdone look is like getting a little out of vogue, which I'm totally here for that. I do not like the overdone look, as we just had discussed just 20 seconds ago. But I do think that overall, this openness about plastic surgery, for the most part, not all, but for the most part, is a good thing, because there are certain things that happen when people are more open. So, for example, like there's less stigma about plastic surgery, so people don't feel necessarily bad or ashamed if they want to go and do it. This also increases, the number of professionals that are out there. It increases the number of people who seek professional care as opposed to doing it yourself, right? Because if it's taboo and you don't want to be seen at the plastic surgery, clinic, then you're like getting the, silicone injections in someone's garage where you hope no one will see it.
So sketchy.
Definitely sketchy.
Yeah.
We have talked about that. It does happen. So, less stigma about aesthetics, I think, is a good thing. I think it does make it safer. There's more patient education out there. If people are talking about procedures, there's more information. And granted, not all of it is good. I see posts all the time that are just totally wrong about certain things, but more information is generally better. And I do think that there's more good information out there than bad. There is increased demand when people talk about it, which is good because it increases the supply of people out there to do it, which that can be good and bad. It drives prices down, but then you do get a lot of increase in people who are not properly trained. And we've seen, rise in medical tourism, which I am totally against medical tourism just because it's not safe. You get a rise in like non-plastic surgeons doing plastic surgery, which also is a really bad thing. But in general, the increase in supply of good plastic surgeons is good for the general populace. Some of the badder things, some of the things that are not as good is the potential for normalized unrealistic expectations. If everyone's getting plastic surgery, then people sometimes forget, oh, well, they look like that because they've had plastic surgery, and it becomes, oh, this is normal. And then for the people who may not, want to do plastic surgery, may have the, means to do it, it creates that unrealistic expectation. So you definitely want to be, cautious about that. More people know it's possible, I think is good. I mean, just more options for people that, may have very potential psychological issues over certain things. There's been a lot of studies about how when people get things corrected, that a lot of their well-being metrics go up. We've talked about those studies in the past. We did talk about the rise of medical tourism, which is bad. Surgeons are now more pressured to do marketing. That is absolutely true. I mean, I do tons of marketing because there is so much competition out there. I think it's good as long as the marketing is, how should I say this? Not legit, but it's honest. We have talked in the past about there is some shady marketing going on out there, even by some legit plastic surgeons, which are just, trying to set themselves apart. I mean, so I guess that's a good and a bad thing. And then lastly, the thing that I think is really good is there's better peer support. If somebody's thinking about having a procedure done, it is pretty easy nowadays to jump on social media and find people that have had that done, and they can, get real life stories about what it is they're thinking about doing versus in the past, you just kind of go to the surgeon's office and the surgeon talks to you about it, and you don't necessarily have a chance to talk to people that have actually done it, even though you very well may know people that have had it done, but no one was talking about it back then, and now they are. And so I think that, and then there's the social media as well, so now I think patients have a increased ability to actually get real world experience from people who are thinking about having, or who have done plastic surgery that they're thinking about doing. So I definitely think there's some positives from this. Again, there's a couple of the negative things that, you just got to kind of keep check on. But in general, I think more openness, more education, more choice is always better, for pretty much anything, but even in the world of aesthetics and plastic surgery. So
I agree.
So, all right, I'm going to recap this one real quick. 2025, a lot of things went down, but one of the things that went down that we talk about is the increase in people being more open about having plastic surgery or aesthetic procedures. There was actually an article in Vogue about it, which I thought was a good article, and I kind of went on a different spin on it, but there was a lot of good information in that, so hats off to you, Vogue. And I agree, there has been a sudden almost tipping point of people being very open about plastic surgery, and this includes celebrities who historically would go to the grave saying that they've never been under the knife. Now you got celebrities going on podcasts, talking about the plastic surgeries that they have done, which then in turn lets the normal people out there feel like, hey, I can talk about my plastic surgery too. And we talked about on this episode how there are good and bad things that come of this. Some of the better things, I think, are increased information about procedures. Increased information is always a good thing. More peer support. There's more people out there that are willing to talk about it. So if someone's thinking about having someone done, they can get some real life experience from someone who's experienced. Also, there's more choice. When more people are talking about it, demand goes up and then supply goes up. There's more plastic surgeons. However, that also opens up a few bad things like the rise of untrained professionals doing plastic surgery, which we see all the time, the rise of medical tourism, which is a very bad thing, as I've talked about many times. So I think overall, 2025 was a little bit of a tipping point year where people really started being open about plastic surgery and aesthetics. I do think it's a good thing overall. You just got to watch some of the potentially bad things that might pop up because of that. So, all right, Brenda, you did a good job carrying me today. I was by myself again.
Good way to start
really
off
sad
the
to
year,
see Sarah not here anymore.
Yeah.
But I am excited about our potential new co-host, and I don't want to spoil the surprise. So you're gonna have to wait. Yay. Brenda, you and the audience.
Okay.
Okay, all right.
Excited.
All right, well, thank you guys so much for tuning in. You don't know how much I appreciate it. We love doing the show. We love talking to you guys. We're going to kind of keep pushing forward here with a new era of Nip Talk. Please leave us a comment. If there's anything you want us to talk about, I would love to talk about it. Just throw a comment on YouTube or Facebook or catch me on Instagram. So, all right, we will see you next week. Bye.